Well, as a nurse in general, you are your patient's advocate. You are their voice. And when you're in the operating room, your patient is asleep. So they cannot say, this hurts, this is uncomfortable, I need this, I need that. So as a nurse, every single thing that you do in the operating room is to benefit your patient and to keep them safe.
I am the patient's voice.
Caregiver.
Advocate.
Guide.
Communicator.
Eyes.
So at the beginning of the day, I come in and I look at my schedule. I take a look and see what procedures I have, how many I have, what special equipment that I'll need for the procedures for the entire day. I make sure that all of my equipment is working properly. I make sure I have it organized in the room so that it is in the optimal place. Placement in the room is huge in making sure that you have the correct flow and placement for where the surgeon will be working.
I make sure the OR is prepped.
Comfortable.
Clean.
Ready for anything.
So as an OR nurse, you really learn how to hear everything that's going on in the room, no matter what you're doing. You are able to hear the conversation that's going on between the scrub tech and the surgeon so that you can anticipate. You can hear what's happening in the surgery, where they're at in the surgery, what supplies they're going to need depending on where they are in the procedure, or if there are any critical events happening. If there's bleeding, you're going to make sure you have hemostatic agents in the room. You're going to make sure that you have blood ordered if it's a procedure where you're concerned about blood loss, and those are things that you learn to have ready depending on the procedures. You're keeping track of how many sponges or laps that they're using on the field and opening supplies for them as they're running low to make sure that they're not having to wait for equipment that they'll need. The operating room is a unique environment where you work as a team rather than solo. You're one-on-one with your patient, so you're able to provide extraordinary detail-oriented care to those patients. You're working with physicians in a completely different way than you would on the floor. You see them every day and they trust your judgment a lot more than they might if you were just calling them to ask about an order or something like that.
I am a part of a team.
One Intermountain.
Changing someone's life.
I love working in the operating room. It's a very gratifying job in general because you're helping other people, but working in the OR, you are truly, every moment is a life-changing moment. I think the more challenging that is, the more rewarding it is. And in the operating room, we are faced with difficult situations, the hardest part of someone's life, possibly, every day. And we get to be there and help them through that, and I think that's really